a randomized study evaluating how discontinuing the commonly prescribed statin drugs affects the quality of life and other outcomes in patients with terminal cancer or end-stage cancer and other illnesses. I'd like to invite our presenter, Dr. Amy Abernethy, who is a medical oncologist and palliative care specialist at Duke University Medical Center in Durham, to present this trial, again from another federally funded trial.
Thank you and good afternoon. I'm delighted to be here today to present on behalf of the Palliative Care Research Cooperative Group, the first ever federally funded cooperative research network focused on palliative care, funded by the National Institute for Nursing Research. At the same time we are innovating and improving the treatment for cancer and survival in cancer, we also need to think about how we innovate in palliative care and how we improve the care at the end of life. The number of pills in our pill cup doubles at the end of life. Medicines to treat the illness, medicines for comorbidities that we've been taking for a very long time, and medicines for symptom control and other burdens. So, for people with life-threatening illness, the optimal management of those medications, including which ones we can discontinue, is a critical question about which we are uncertain. An example is whether or not we must continue or need to potentially discontinue drugs like statins prescribed to lower lipids, which are usually long-standing medications that we don't know when we can stop. So the question at hand is it safe to discontinue statins for the patient with less than a year to live? This is a multi-center, unblinded, pragmatic clinical trial. Patients were randomized to discontinue or continue their statin medications at the time of study entry. The participants were adults who had advanced life-limiting illness and a prognosis of a year or less. They had decreasing performance status and were taking statin medications for primary or secondary prevention. The outcomes of interest included the primary outcome, which was the rate of death from 60 days at the time of randomization, as well as other questions around survival, quality of life, satisfaction with care, and the number of medications taken. Cost was also a consideration in this study. 381 participants were randomized to either discontinuing statins at 189 people or continuing statins for 192. These were older people with a mean age of 74 years. About half were women. About half had cancer, and nearly 70% were on statins for 5 or more years of their life. Looking at the primary outcome variable, it was not statistically significant in terms of the difference of the rate of death at 60 days from randomization in the trial. When people had their statins discontinued, the rate of death was 23.8%, and when it was continued, it was 20.3%. If we look at the Kaplan-Meier survival curves, what we see is for those people who had their statins discontinued, they actually lived a bit longer at 229 days, and for those people who had their statins continued, they lived 190 days. However, when we look at the confidence intervals, it reminds us that these differences are not statistically significant, and hence survival is not impacted by discontinuing statins. Looking at the important secondary endpoints, what we see is that for people who have their statins discontinued, there is a real trend as well as significant findings in favor of discontinuing statins. Total quality of life is significantly improved. There's a trend towards decreased symptoms. The number of medicines in the pill cup other than statin medicines significantly decreases, and there's a trend towards improved satisfaction with care. Cost is a real question as well. If we look at the cost savings on average for a patient in the study who had their statins discontinued, there was a savings on average of 3.37 days. When this was applied across the mean time in the trial, this meant $716 saved per patient. If we apply this to the 2014 population estimate, what we see is that if these results were applied in the last year of life, it would mean approximately $603 million saved. And if we look at the 2040 population estimate, this would be about $1 billion saved in 2014 dollars. So, in conclusion, Discontinuing statins during the last year of life does not adversely affect 60-day mortality or overall survival. In fact, benefits were observed, including improved total quality of life, fewer medications, a trend towards fewer symptoms and improved satisfaction, and lower overall costs. A real clinical question is whether to continue or discontinue statins in the last year of life. We still think this is a patient-centered decision where clinicians and patients together talk about what to do. However, as clinicians, we can now feel confident that we're not harming our patients by making this decision. Thank you.